Dr. Purcells.
Yes.
What is gynecomastia?
So gynecomastia is basically a fancy term for saying breast growth in males. What usually happens is that sometimes there can be a fluctuation between the amount of estrogen and testosterone that men develop. Oftentimes it can be attributed to steroid use, marijuana use, and other medications, and sometimes it just happens. And so men experience growth of their breast tissue, and they can describe it as being uncomfortable or painful. Usually what will happen is that there will be some growth and then the growth tapers off, but it doesn't matter how much diet or exercise you do, the amount of breast tissue that you grew does not get smaller. And I actually had a patient ask me to do this reel for a friend that she knows who is a man. So this is for him. My recommendation, if you have gynecomastia, is to go and get the advice of a board-certified plastic surgeon, because it is a very straightforward solution. Depending on the position of the growth on the chest wall, as well as the amount of growth, there are different options. Sometimes liposuction and just compression therapy is therapeutic, and sometimes surgical excision is required. So it really just depends on each individual's anatomy and what their goals are, but it is absolutely something that can be taken care of. Patients that have this procedure have a very high satisfaction. So it's usually one procedure and then it doesn't happen again. But it is important if you're considering going on steroids or marijuana to know that this can be a side effect. Let me know if you have any questions about gynecomastia. It is super common and there are straightforward solutions and you shouldn't be ashamed.